It's truly an honor to bring 8 weeks of gatherings with you and share the findings we've actually, because when we launched the Global Compact on inclusive and accessible cities in Berlin, we couldn't have imagined that New York, as a founding signatory, would be at the front line of this crisis and would be sharing experiences with Sao Paulo and Abu Dhabi, and then that we would join with other signatories like Helsinki and with Barcelona to really understand how cities can learn from each other. But this isn't just about what the cities can learn from each other, it's about a multi-stakeholder platform that has academia, that has the development agencies like the World Bank, that has other stakeholders, whether it's regional and national or grassroots organizations that work on massive initiatives like Special Olympics or very local initiatives like the San Francisco's Disability Justice Coalition to provide food and shelter, and to find linkages between homelessness and between mental health and between economic isolation and economic empowerment. So with that, let me jump straight into a really dynamic group of partners and really hear from them what they've been doing. Maybe start off with my dear friend, Charlotte McClain Nhlapo, who's leading things at the World Bank, specifically within their group on urban resilience. Charlotte, would you like to say a few words?
Yes, of course.
Yeah, please. The floor is yours. And some of our partnerships with the World Bank, also how we're applying this, addressing the COVID.
Great. So thank you so much, Victor. And thank you to the United Cities and local government for the opportunity to share some of the work that we're engaged in the bank. As Victor says, I am the Global Disability Advisor to the World Bank Group, and I sit in the global unit and provide technical support across the bank on disability inclusion. So I think I want to start off with a very categorical statement, and that is that the bank is committed to striving for all aspects of disability inclusion in our projects. And so to make sure that this goal happens, what we've done is to put in place a disability inclusion and accountability framework that sets out a roadmap for World Bank staff on how to be more inclusive, and it identifies some key entry points. And central to these entry points is the principle around accessibility. So the entire document is built off of the principle of accessibility. The document also brings in a number of principles from the CRPD. Almost 18 months ago, the bank put in place what are a set of 10 standards, and these collectively make up the environmental social framework, which is referred to as the ESF. And the ESF is important for this discussion because it speaks directly to the issue around non-discrimination, and very importantly, introduces the concept of universal access. Now, what's important about these standards is that they offer the borrower. And this is obviously very related to the work of local government. And so I just wanted to flag those as an important piece of work that we're doing. To support the environmental social framework, we have developed a good practice note on disability and non-discrimination. And it too has a very strong dimension on accessibility. And then finally, in relation to our authorizing environment, we have 10 commitments to advance disability inclusion within the bank. These commitments were developed by our senior bank management ahead of the Global Disability Summit that was held 2 years ago in London and was co-hosted by UK Aid, the International Disability Alliance, and the government of Kenya. Out of these 10 commitments, there are 2 commitments that are directly linked to the discussion today. The one is to ensure that all public facilities in post-disaster reconstruction are disability inclusive. And then, of course, the other one is around a commitment for better disability disaggregated data. And I'll come back to the data piece in a bit in relation to COVID-19. But just to quickly say, in order to monitor these commitments, we're undertaking a portfolio review of our urban projects, and we're benchmarking disability inclusive indicators for our projects. And this is with a view to develop a baseline. So what's central to the work of the bank, central to the work that we do at the bank, is to provide the technical and intellectual leadership on disability inclusion. And so what we do, a large part of what I do and my team does, is to build the analytics and the evidence around disability inclusion. And to this end, we've developed some very relevant technical guidance for bank staff. One of them is a very popular guidance book on disability inclusion in water operations. And that obviously is very relevant today when you think about the importance of hand washing and good hygiene. Similarly, we have developed a guidebook on disability measurement that sets out how to better collect comparable data, disability disaggregated, and introduces the use of the Washington Group short set of questions. So in many ways, this is a great segue to the importance of data and the importance of the lived experience of persons with disabilities in the time of COVID. And so we at the bank are delighted, absolutely delighted, to be partnering with World Enabled and the UCLG on the survey. And I would strongly encourage you to take the survey and share it widely amongst your networks, because we know that data is our solution to effective and inclusive policies and responses. More specifically on COVID-19 and persons with disabilities, at the bank, we've pushed out an issues paper on persons with disabilities that is being used for internal purposes. We've also provided technical expertise to teams in the bank on how to include persons with disabilities in various responses. And I have presented to senior bank officials on alternative formats for consultations of persons with disabilities and DPOs in forthcoming projects given the COVID-19 situation. I wanted to stress the point that we continue to host a series of check-ins with our colleagues at country level to make sure that we have the pulse of what's going on the ground. We're working very closely on the education piece. We currently know that 1.3 billion children are out of school, and that many of those will be children with disabilities. And so we are looking at supporting work around that. Again, through a survey which has gone out, we've had 3,000 responses to the survey that looks at the impact of COVID on children with disability. And then I just wanted to close by saying that this survey will become part of a larger discussion paper, which will be a global public good, so we will share that. And then flag the important point around sustained coordination. And this is great to be part of this discussion today, but I think sustained coordination means we go on after this. And therefore, I'm really excited to have been asked to join a UN time-bound task team under the leadership of the Undersecretary General Menendez. So that should be a very exciting initiative. And finally, I look forward to working with you all and learning about what works, but also learning about what doesn't work. And again, I invite you all to please take the survey, because data is going to be the solution for how we move forward. Thank you, Victor.
Thank you so much, Charlotte. As you can tell, we've built such a tremendous network of multiple stakeholders, from the World Bank to directly with cities to grassroots organizations. Get your leadership at the bank, get your technical capacity to leverage this data that we've built, that we will have together, will immediately open up funding in terms also in sub-sovereign loans, sub-sovereign grants as well. So that'll be important as we listen to cities, as we localize the sustainable development goals. Let me also ensure that we have a continued engagement, as you said, with UCLG under the framework of this global compact. And we're really thinking of this as a 10-year campaign, with this year focusing on COVID, but in future years looking at other ways that we can collaborate on data as well, and identify ways to open up access and inclusion in urban environments. Let me make sure that we have time for our other speakers. We have a really great intervention from Kristine Lange. Kristine Lange is a program specialist on disability inclusive humanitarian action at UNICEF. Kristine, we actually started World Enabled working with UNICEF in the context of drafting the UN Convention on the Rights of Persons with Disabilities. And we published a little book called It's About Ability. Now, so many years later, 13 years later, we're now working on this issue of disability inclusive humanitarian action. What has UNICEF done to merge its commitment on disability inclusive child development as well as humanitarian action? The floor is yours, Kristine.
Great. Thank you. Thank you very much for the opportunity to be here today and to learn from all of the speakers. It's been such a rich discussion, and so happy to have the opportunity. So while children haven't been so visible in the COVID-19 pandemic, they have been significantly impacted, and children with disabilities even more so. So at UNICEF, we've heard numerous reports of children with disabilities living in institutions, facing high levels of infection, serious complications, and even death. Children with disabilities also face increased risk of violence, exploitation, abuse, and neglect, as families and households are under increased pressure and isolated from their usual support networks. And in the context of school closures, children with disabilities who were already excluded from education are at risk of being even further left behind, as we often see that distance and remote learning programs are not accessible. So recognizing this impact on children with disabilities, UNICEF has firstly produced 2 guidance notes on inclusion of children with disabilities in the COVID response. One of these guidance notes addresses access to water, sanitation and hygiene, to education, to mental health and psychosocial support, child protection and other services. The other note focuses more on persons with disabilities as actors in the response. And so it provides guidance on how to engage children and adults with disabilities as actors in response to COVID. Now with UNICEF, as was already mentioned in the introduction, I work on disability inclusive humanitarian action. And in humanitarian action, we know that emergencies present us with opportunities. As we've already heard from many of the speakers today, this crisis has forced us to rethink the way we deliver services, the way we do our work, interact with each other, and the way we protect the most vulnerable in our communities. And we're now finding that some of the changes that we've made are for the better. So at UNICEF, we're working to make sure that everything we do in response to COVID contributes to building a more inclusive society. And I'll just touch on 3 examples as briefly as possible. So firstly, the pandemic has highlighted that more than ever before, that children with disabilities face risks living in institutions. Not only high risks of infection, but also of abuse and neglect. And in a new normal, UNICEF is working on ensuring that we make a renewed commitment to ensuring that every child realises their right to grow up in a family environment and that families are properly supported in this. So in Kyrgyzstan, for example, UNICEF is working to strengthen community-based services for children with disabilities, is providing support to parents and working to address a lot of that stigma that often leads to placement of children with disabilities in institutions. Secondly, even before this crisis, children with disabilities were more than 10 times more likely to be out of school. And now we're being forced to think creatively about how to ensure that children can continue learning despite extensive school closures. So in the new normal, UNICEF is working to ensure that this creative thinking and this investment in adapted approaches to learning extend to all aspects of education. And as schools reopen, we're working to support education actors to adapt curriculums, teaching and learning materials to ensure that they're more inclusive of all children. So for example, in Uzbekistan, we've supported tools for children with disabilities and from ethnic minorities that feature sign language and multiple language subtitles. We also provide print and digital resources for parents and caregivers to help them support their children during the crisis through daily activities and tips. As UNICEF has seen, and as many families can confirm, being out of school has a huge impact on children that goes well beyond academic outcomes. Thirdly and lastly, throughout this crisis, we've also been reminded of how important access to information is. And children, thankfully, have not been forgotten. We've seen numerous examples of information being presented in child-friendly formats, and even, for example, leaders hosting press conferences for children. In UNICEF country offices, we've also seen many great examples of information being made accessible to children with disabilities through the development of accessible and child-friendly formats. So for example, in India, UNICEF produced information about COVID through videos with puppets and sign language. And this was done using local resources without even access to a basic studio setup. I personally haven't seen this level of commitment to accessible information in any other emergency that I've been involved in. And I'm hopeful that this will become the new standard and this will become the new normal. We've seen clearly throughout this crisis that it is possible, even in more challenging and resource-constrained settings, to ensure that information is always provided in accessible and child-friendly formats. So we're hopeful that this will become the standard way of doing business. Now, I've aimed to be very brief, so these are just some examples. There are many more. As UNICEF, we look forward to continuing to work with all of you to ensure that children with disabilities are no longer left behind. We need to ensure that everything we do as part of the response to the crisis contributes towards this goal, and that we realise every opportunity to build more inclusive communities and service systems. Thank you very much again for the opportunity.